Hi, my name is Abby, and today I'm going to be showing you how to perform wound care, change your dressing, irrigate the wound, and then put on a clean dressing. So before you begin with the procedure, you're going to check the medical record to see what kind of dressing needs to be done, what the dressing needs to be changed, and everything like that. Then you want to wash your hands, put on PPE if it's indicated, and it's not in this case. Then you want to go in, you want to introduce yourself, and then ID the patient, check and make sure their name and date of birth matches with their wristband, which it does. Then you want to assess if they're having any pain before you start the procedure. That way you can give them analgesics now and then wait for it to kick in and then come back in and do it so that they're comfortable. So we've already done all that. So we've already performed hand hygiene. So we're going to remove the old dressing. So we're going to put on just regular clean gloves. And we're going to remove the dressing. So you want to use a push-pull method so you don't tear their skin. Okay, and then you want to assess the dressing, see if there's any discharge, any fluid or anything like that. And then you also want to assess the wound at this time to make sure that there's no signs of infection, make sure that there's no drainage, anything like that, such as redness, temperature change, which could indicate, like I said, infection. So then you're going to discard this, and then you're going to take off your gloves, discard those, perform hand hygiene, and then we're going to go ahead and set up our sterile field at this time. And you want to also check, after you take the old dressing off, you want to check the drainage tubes and everything too, if there are any, for anything like that. So we already got all of our equipment out here. So you want to open this up. And this work area has been cleaned and it should be elbow height, but this is the tallest table I have right now. So then we're gonna discard this. And you can touch your 1-inch border. Again, you touching your 1-inch border. You don't want to reach over your sterile field, which I just did. That would break sterility, so you want to reach around and never turn your back to the thing. So obviously I'd get a new sterile field, but this is the only one I have, so we'll pretend like I got a new one. You can reach to the sides of it and everything. This would work much better if I had more stuff. So you want to just set everything up. I'm going to introduce some things to the sterile field now. So drop it 1 inch above you, away from you. Make sure it's not below your waist, which this is, because this is all I have. But again, you don't want to reach over your sterile field, but this table is small. So you want to peel the top off, introduce your gauze, get rid of this. I'll start with this. And then you want to open this, introduce it to the field. Make sure it's 6 inches. I know that was not 6 inches. You'd open this gauze packet. You'd open these Q-tip things, which they were already open, so. And then open this up since we're non-sterile right now. Put the cap facing up. You want to lip it into the trash and make sure that you cover the label. So I flip it and then I pour some into this gauze. And then I set it down here. And then I would get sterile gloves. Okay,